With increasing age and increasing life expectancy in India, nowadays more and more patients are coming into the hospital with heart failure. Hi friends, I am Dr. Sandeep Singh, Senior Director and Head of the Department of Cardiac Surgery at Max Super Specialty Hospital, Vaishali. Today we are going to talk about role of cardiac surgery in heart failure. Heart failure is a condition in which patient's heart cannot pump enough to sustain the ventilation and or the oxygenation and to sustain the blood flows into the body organs. These patients come into the hospital with air hunger, with low blood pressures, and are very critical patients and very difficult patients to manage. Patients who cannot be managed by medical management or who in ICU who go into a stage which is called stage 3 or stage 4 of heart failure are patients who ultimately require something beyond an ICU management or medical management. These patients can either, if they have coronary artery disease, can either be treated by the cardiologist by putting in stents or else require surgical management, that is to say bypass or remodeling of the heart. Patients who finally cannot be managed by the cardiologist or medical management ultimately land up on the cardiac surgeon's table, and these are patients which are very difficult to treat. Some of these patients fortunately can be managed by doing bypass surgery or valve replacement or something called remodeling of the heart in which the heart is opened and the infarcted territory is removed and restitched. But there are a lot of patients who ultimately go beyond this stage or have a disease which cannot be managed by conventional cardiac surgery. These are patients who require either heart transplant or left ventricular assist devices. Now if we talk about heart transplant, though a very exciting field, can give very good results, but is very difficult to do, not because of the technical reasons but because procuring the heart is very difficult. There are a huge patient load of recipients but very few patients who can get the heart because the donors are very limited. So seeing the difficulty in heart transplants, a new field opened up, and this is the field of left ventricular assist devices. Left ventricular assist devices are devices which support the heart by pumping the blood into the organ when the heart can't do that. These left ventricular assist devices initially were very big, very difficult to be adjusted into the body, but with as time and they would last only a few months or a few years. But as time has passed, the devices have become smaller. These devices are easier to implant, and these devices can be totally implanted into the heart. So sometimes you can have a patient with a left ventricular assist device and you wouldn't know except for a pouch which carries the battery. And with the exciting thing that is happening now is that these devices are becoming long-term devices. That means these devices can last for 10 or 15 years or maybe more. And if this becomes more and more easier to get and more easier to put, then this left ventricular assist devices may finally replace heart transplant. I hope you found this video interesting and informative. And if you have any questions, please put it in the comment box below. Thank you for watching.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.